this is Dr. Emma Hitt-Nichols. Thanks for joining me for this week's episode of the new FDA Approvals podcast. So first up this week, the FDA has granted full approval to Erdafitinib, also called Balversa, for treating adult patients with locally advanced or metastatic urothelial carcinoma with susceptible FGFR2 or 3 genetic alterations whose disease has progressed on or after at least one line of prior systemic therapy. Erdafitinib is still not recommended for the treatment of patients who are eligible for and have not received prior PD-1 or PD-L1 inhibitor therapy. So the current approval amends a previous accelerated approval of Erdafitinib for FGFR2 or 3 positive urothelial carcinoma patients after failing platinum-based chemotherapy. The latest approval was supported by the results of the pivotal phase 3 THOR THOR trial, which demonstrated significant overall survival improvement in patients with FGFR2 or 3 altered metastatic urothelial cancer previously treated with anti-PD-L1 therapy. Erdafitinib showed a 36% reduction in death risk and a median overall survival of 12.1 months compared to a 7.8 months with standard chemotherapy. The latest approval of Erdafitinib was granted to Janssen Oncology. Also last week, the FDA has accepted the pre-market approval application for tumor treating fields, TTFields, in combination with standard systemic therapies for platinum-resistant non-small cell lung cancer, NSCLC. TTFields, a treatment modality involving mild electrical fields to disrupt cancer cell division, was first approved by the FDA in 2011 for certain tumor types, including glioblastoma multiforme. The recent application, now under substantive review by the FDA, is supported by the findings from the phase 3 LUNAR study. The study demonstrated enhanced median overall survival in patients with NSCLC treated with tumor treatment fields in combination with standard of care therapies post-progression following platinum-based therapy. Specifically, patients receiving tumor treatment fields combined with an immune checkpoint inhibitor or docetaxel showed improved overall survival compared to those receiving standard of care therapy alone. The regulatory decision by the FDA is anticipated in the second half of 2024. Tumor treatment fields are manufactured by Novocure. Also last week, the FDA has approved the first handheld artificial intelligence-powered medical device designed to assist clinicians in detecting skin cancer. This device, manufactured by DermaSensor, is an adjunct tool that can lead to further evaluation of skin lesions that have been primarily identified as suspicious. The device employs AI-driven spectroscopy to analyze lesion characteristics at the cellular level and beneath the skin surface. The approval follows an observational study led by Mayo Clinic that evaluated the device in over 1,000 patients. The device provides immediate results through an algorithm derived from over 4,000 analyzed malignant and benign lesions. While not a primary screening tool, the new device aids in the detection of melanoma, basal cell carcinoma, and squamous cell carcinoma, particularly in patients age 40 and above. The device is intended to complement the overall clinical assessment, including visual analysis by non-dermatologist physicians. The FDA has mandated further validation testing across diverse demographic groups to ensure its effectiveness across all patient populations. Now, a word from the supporter of this podcast, Nascent Medical. Attention all businesses in need of exceptional medical writing support. Nascent Medical, nascentmc.com, is the solution. We are a team of skilled MD and PhD level medical writers who specialize in fast turnaround needs assessments, manuscripts, slide decks, ad board summaries, and more. Don't settle for anything less than excellence when it comes to your medical writing assistance. Visit nascentmc.com. Also this week, the FDA has approved exa-cel, that's also called Casgevy, for treating patients with transfusion-dependent beta thalassemia, an inherited blood disorder. This follows the approval of Casgevy for sickle cell disease treatment in December of last year. The expanded approval of the therapy was widely expected, but came 2 months ahead of the FDA's expected PDUFA date of March 30th, 2024. Casgevy, developed by Vertex Pharmaceuticals Inc. and CRISPR Therapeutics AG, is the first treatment using CRISPR gene editing technology for transfusion-dependent beta thalassemia. Bluebird Bio also gained approval in 2022 for its gene therapy product Zynteglo to treat transfusion-dependent beta thalassemia. Also last week, the FDA approved immune globulin infusion 10% with recombinant human hyaluronidase, that's called HyQvia, as a maintenance therapy for adult patients with chronic inflammatory demyelinating polyneuropathy, CIDP for short. This approval is based on results from the advanced CIDP 1 and 3 trials, where HyQvia demonstrated the ability to prevent relapse in neuromuscular disability and impairment. Initially approved in 2014 for treating primary immunodeficiency in adults, HyQvia is the only FDA-approved combination of immunoglobulin and hyaluronidase. For adults with CIDP, HyQvia can be infused up to once monthly due to its hyaluronidase component. This facilitates the dispersion and absorption of large volumes of immunoglobulin in the subcutaneous space between the skin and the muscle. The approval was granted to Takeda Pharmaceutical. And finally, last week, a national survey suggests that many physicians have a limited understanding of the FDA's approval processes for new drugs and medical devices, with only 41% reporting a moderate or better comprehension of the drug approval process, and only 17% for medical devices. This survey, conducted by Dr. Sanket Dhruva of the University of California, San Francisco, and colleagues, reported their findings in the journal Health Affairs. The study involved 509 physicians in specialties such as internal medicine, medical oncology, and cardiovascular medicine. Findings indicate that most physicians perceive the FDA's current standards for approval as adequate, yet most believe that approval should be based on 2 or more randomized controlled trials, despite awareness that some expedited pathways may require only 1 trial. There is a notable expectation among physicians for rigorous post-marketing studies for products approved through expedited processes, and a concern that misconceptions about FDA approval could lead to inaccurate patient advice. This study highlights the need for enhanced education on FDA approval processes in medical education and practice, according to the researchers. The link to a news article reported in MedPage Today is in our show notes for this episode. All right, that's it for this week. Thank you so much for joining me. And I just wanted to let you know about a quick course, a free course for medical writers, editors, and anyone else who might be listening to this podcast. It's called ChatGPT-4 for medical writers and editors. Again, it's a free course. It's really short, like 20 minutes, and just shows a few hacks and things to do to speed up workflow using generative AI, ChatGPT-4, and also to enhance accuracy, which is something that's so important in this field. I'll also show you a couple of essential plugins and extensions to make your job easier, and ways actually that you can personalize ChatGPT-4 just to suit your needs. So I think it's very eye-opening if you're not totally familiar with all this stuff. So check it out at learnamastyle.com, learnamastyle.com. Thanks so much and have a wonderful week. I hope that you'll be back next week. Take care.